backward from the future, and we need to marry all of our justice campaigns and see each other as co-equals. Because we're isolated, we're frankly not respectful of one another, we're not seeing things strategically. We have got to turn this around, and this is a great opportunity. I'll share this information with folks as well. So I'm wearing two hats today. One pair of states, which works at the state level, and we have congressional legislation as well. We have 18 states that are running single-payer bills that will be introduced next year. And we have enabling legislation working with Ro Khanna in the House and Ed Markey in the Senate that would allow states that adopt universal healthcare systems to access those federal dollars, bring them back to the states, so you have a more robust system, and you don't have to ask your taxpayers to pay more money, as well as enabling legislation around the legal ERISA waiver. I know Steve and I have a different view on this, but nonetheless, that's what's in this legislation. It makes it easier for states to adopt. And we have about 6 states that are in our top tier that are very close to getting a universal healthcare system. We can talk about that in more detail later. But that's what our focus is to get 1, 2, or more of these states across the finish line in the year 2029. We have a plan to do this. Get 1 of those, or 2 of those, or 3 of those adopted and prove that we can do this at the state level. That'll give new momentum for the Medicare for All movement. So the bill that Camilla Jayapal's carrying in the House and Bernie's carrying in the Senate, this will give a real boost to that. Because nobody will be able to deny the actual facts on the ground that implementing single payer in 1 or more states, and that's the West Coast states, New York has a real shot at it as well, will demonstrate exactly what we need to do. It's also about saving our democracy, to bring it full circle. It's also about defeating fascism. Because if we don't fix this, and if we don't fix it quickly, the Democrats may come back into power, but if they don't deliver, we're going to go, I think, into an even deeper form of fascism. It's not going to be any better. We've got to pull ourselves together now. So I probably went over time, but I just
a little bit.
Well, I just want to sort of.
Well, you drove the furthest.
Yeah, well, in any case, yeah, thank you. Pass it on to Steve.
Yeah, Steve, you can talk for a little while too.
I could listen to Chuck all day long. I'm Steve Larchuk, and an attorney, graduate of this fine university. And in the year 2006-ish, when we were all just pups, I was in my 50s, and we started pushing hard for Pennsylvania to adopt its own version of healthcare reform. And the first thing we discovered was that there was no bill. There was no one that ever actually drafted one. And in the drafting process, you begin to reveal the challenges. And when you get into the details, I don't say the devil's in the details, I say the angels. The angels are in the details. If you think about it, if you want it to happen. So we wrote the bill, and it was making terrific progress here in Pennsylvania, really even better than we might have dreamed. And it was derailed by, of all ironies, the Affordable Care Act, which passed, and everybody said, problem solved. You know, thanks Steve, thanks Chuck, thanks Scott, you know, go away. And so we did, we had to go away because really no one was listening to us because they thought, problem solved. Well, the problem's not solved, although let's be honest, some problems are, some parts are. But it's hard to remember, but I remember vividly that before the Affordable Care Act, there were caps on how much insurance would cover. It might be $2 million, it might be some other number, but if you were sufficiently sick, you would blow through that in the first year. Before the Affordable Care Act, if you had cancer, your insurance company would get the first couple of bills for chemo and say, oh my God, this lady's sick. We got to cut her loose. You know, we're not going to pay for all this. And there was no law against that. I mean, it's think of that now. Of course, it was just as outrageous then as it is today. But the difference is today, thanks to the Affordable Care Act, that's not possible. But we could talk about it for hours and hours and hours, and did at the time. But a lot of us who were pushing hard for this kind of healthcare reform saw the weaknesses and flaws in the Affordable Care Act and knew, I mean, we're all surprised it survived at all. And of all people, Justice Roberts saved it twice. Hard to believe, given the dark corner that he's turned in his life. But nevertheless, absent that, we wouldn't be where we are. But all that's saying is, we are teetering on the edge of losing what we worked so hard to get, and even what we got was only half a loaf, if that. So, we're all working at it again. Here we are, 20 years later, you know, we get the band together again, and really the problems are mostly still there. And we are pushing a bill in Pennsylvania, and somebody else wrote it. I didn't write it this time. And they said, I said, well, gee, can I read it? And so I read it, and 80% of it was word for word what we wrote 20 years ago. And so somebody found it. And I have no pride of authorship, except maybe I am proud that it's still viable after all this time. This particular bill, which Healthcare for All PA is pushing hard, I met recently with the principal sponsor in Harrisburg. It's going to be introduced here in Pennsylvania again. Now we're at the end of the session, so there's not much that's going to happen with it this time, except to break the ice again, and really tee it up for early next year when we'll have a full 2 years. But that sort of provokes this comment that Chuck's talking about strategy. It is very much a strategic thing, but it's like windows opening and closing. And when the Affordable Care Act passed, it's because the window cracked open. We had a supermajority in the Senate, we had a supermajority in the House, and we had a Democratic president, and who wanted to do something. And it was bumping along, and then of all tragedies, Ted Kennedy died. And he was the deciding 60th vote. And of all tragedies, a guy named Brown, Republican, took his seat, and so they went through this incredible gymnastics through reconciliation and all that. But there's a reason why the bill ended up so bad. It's because it was never finished. It got as far as it did, and they used this reconciliation nightmare to get it through, and they did. And then, Vice President Biden said it was a big fucking deal. It was, but all things are relative. It had a very potentially short shelf life. So we're at it again, and thank you for coming, and whoever watches this online or wherever, thank you for that. But I just wanted to say, it occurred to me this morning that I only had a few minutes with you, and I thank you for that. But what can I say that's different, that I haven't said up literally 100 times, maybe 500 times in the last 20 years? And here it is. Here's what we think is different. Why can this time it work? And I think it's because of technology. And I know we're anti-technology, but I think maybe for a different reason. A part of our pitch is always that universal health care will actually cost less because it eliminates the whole billing process. A whole lot of inefficiencies in the system go away, and you can use that money to pay for everybody's care. That's always been the story. If you say it's going to cost more and it's going to raise taxes, you're not going to have very many people, helping you. If you say it's going to cost less and the care will be better, that's good too, but it's still a struggle. What's different? What's different is, of all things, artificial intelligence, and of all things, robotics. These are things that none of us could have even conceived of 20 years ago. But those two things, as much as all of us bleeding heart liberals hate it, the fact is, it's coming, whether you hate it or don't hate it, but you might as well turn it to your advantage. We can do that in healthcare by helping point out that, for example, nursing homes where they have near 100% turnover in staff every year, if you have a humanoid robot, strong, capable, that can be there 24/7, 365, I mean, that's much more cost effective. Believe it or not, they're not going to cost that much. You might think that's going to be a $10 million robot. It's not. it's going to cost a couple $100,000, which is also a lot, but less than the cost of all those folks coming and going and trying to take care of, me in 10 years from now. So that's an example. There's the robotics is going to dramatically improve our ability to make efficient the human resources of healthcare, and that's big one. Artificial intelligence, likewise, is going to be able to bring to the average consumer, health consumer, a access to the knowledge of the universe in terms of healthcare. And I'm not saying that we should all just become reliant on Google or or Gemini or whatever it is, but I think it helps. And to the extent that it helps, it shrinks the cost. And if you can say to people, this time is different because we have something new that's part of the equation, well, now you might get the attention of some folks who maybe are deeply invested in information technology and AI and robotics. Maybe the very people who are screwing us and have been for the last 20 years will suddenly realize we've always been on their side, and it's time for them to be on our side. That's it.
Okay, well, thanks everybody for speaking. And what I'd like to do is just have, since everybody's now heard what everybody else has said, if each person will probably go back to you, Arjun, if each person could give about 2 or 3 minutes about thoughts that you had just in general, if you've not changed what you're thinking, but if you've got, it kind of stimulated some thought, I'd like to hear from that, and then we're just gonna open it up to the audience.
Yeah, I had a couple of thoughts. So Sally, when you were speaking, I feel like your life and how you've experienced the healthcare industry is by definition what happens when you have a profit-driven healthcare system. One of the reasons universal coverage is there in every other country is because those countries have realized the more financial burden you put on the patient in relation to their healthcare, the more they will avoid preventative care, the worse their health will get, which will in turn drive the cost up. That fact is very, very, very straightforward, and it is just true, right? Because if your healthcare costs more, the thing you avoid is the preventative thing, and then if you're really sick, you can't avoid it, right? So you have to go and get the surgery, go to the hospital, etc. That is Econ 101, and sometimes what I'm trying to do is just simplify concepts, because that is an Econ 101 concept. Every economics class in the country will teach pricing elasticity of demand. That's what that's called. So that kind of just came into my head because when you were talking about okay, I'll do it once every 2 years, and hopefully on the other year, it's the literal same scenario. And that happens across many, many diseases to lots of people. When Chuck was talking, I really agree with the concept of being strategic. Even when I was talking about the doctors, sometimes what I feel the doctors they're not thinking strategically. So they're thinking, maybe I'll make a little less money, which who knows if it's true, it's not some math problem. And they're not thinking about strategically, what field are you playing on? So if I'm the doctor and all of a sudden the patient is deciding to come to me or not come to me because I may or may not be in network with an insurance company, that is a huge problem because strategically I am losing my relationship with the patient. There's some third party that I'm not in control of that is coming in the way. And not thinking strategically about the field and coming up with very, very simple terms, you will just get run over by people who think strategically because it does matter. It does matter. It does not matter. That's why people think strategically. So that came to mind. And then I thought that AI framing was interesting because I'm a tech guy, right? So I'm a tech engineer. And historically I've said it's not a tech problem, it is a healthcare problem, right? That is a problem by by definition not a technology problem, but it is interesting because it is true that the technology works better in a single payer environment. So like my team at work, everyone goes, it's an engineering team, and everyone's like, oh my God, you're so efficient. And like part of it is because we're doing a good job, but part of it is because we only work on Medicare. So when you are working in a single, like for me, it's single payer. We only work on Medicare. So when you're in a single payer environment, so much complexity gets pulled out, and then we can literally see it in our dollars. They're like, your team is very, very high leverage, and the technology is making us scale, but it's because we are like single payer, right? Brand, we only work on Medicare. So that is like interesting, and having that framing as like single payer is actually tech positive. Who knows? It'll probably resonate with some
I
people.
like that.
Yeah, it's interesting.
Yeah.
Wow, you guys were all fascinating.
You're fascinating, Sally.
The first thing I thought of that I did totally forget to say was I did reach my $1 million cap, and I remember it was right before the ACA was passed, and I got a phone call from the insurance company, and they said, I'm sorry, we're gonna have to drop you. And then when the ACA was passed, and I mean, you can't imagine the panic that went through me, you know, because I had a 4-year-old daughter, and I'm thinking, oh my God, like, what am I gonna do? Here I am, I have brain cancer, it's gonna come back, what am I gonna do? The ACA was passed, and I literally celebrated. It was just like, even though in the ACA, it was like one of those, you know, double-edged swords, but yeah. But with you, I'll start with you, like, it is like AI, I fight these data centers tooth and nail in my own area, but I will say, it is kind of a dialectical contradiction because I do see exactly what you're saying. It may make the difference. Everybody that I work with for single payer healthcare with different groups, they all have white hair. You all, except for Arjun over here.
I've got a little bit.
Yeah.
Or no.
Or no hair, no hair. And they've been fighting forever, and I think, is this ever really gonna happen? I mean, people in this country are so, like Scott says, frogs in a boiling pot, and so used to this when I go out and talk to them, oh yeah, but I have good healthcare, and I'm never gonna lose it, and I'm fine, and my job, stable, whatever. And I think, man, you just don't know. You wait till you're like me, and you know, your brain cancer comes back or whatever. You lose your job and you lose your insurance. And so, yeah, I can absolutely see that may make a difference this time. I hope, but I will also say, as long as we have a Senate Majority Leader like Joe Pittman,
He's Pennsylvania.
well, we'll stay single payer. That is an issue, but I've been targeting this man because he's my rep. I've been targeting him hard. State single payer, you know what? I'm a bulldog with a bone. You just send me after him, and I'm going after him. And what you said, fascinating. I'm all in. We're going to talk after this. I may have to recommend this book to my book group. And Origin, I don't know what to say about all of this behind the scenes business work, but you work with Medicare, it's like a single payer, and I'm on Medicare because I'm on disability. But when I got on it, I was very confused. Very, very confusing to everybody. And older people are very confused by it. So there is that. It's very confusing to people. And I'm thinking of having maybe like a clinic at our library to explain it to people.
Yeah.
Because these agents go around and they want to talk everybody into Medicare Advantage.
Yeah.
You know, privatize Medicare, and people just have no idea. They don't grasp the concept, and I get why. It's very confusing. So if we had a single payer system, it would make life so much easier for everybody across the board. So anyway.
Even in Medicare, the privatized part makes it not
just
single
makes it-
payer, and
yeah.
they have to learn.
And more people are on Medicare Advantage than they are on Medicare, and so that's where we run into problems. Okay.
Thank you. And a shout out to Scott for for putting this together. Tremendous amount of work goes into any organizing event. I can speak to that. So yeah, well, Arjun and Sally, the patient story I can relate to, and the doc story too. I'll just touch on each of those just to kind of respond a little bit. But about 8-9 years ago, I went blind in my left eye. So I have advanced glaucoma in both eyes, and this one's being treated. I have to, drops to keep the pressure down and so forth. But I was in the middle of a crisis. I'll just leave it at that. I was in the middle of a family crisis, and I went in to see my retina doctor, and I had 8 surgeries. Multiple surgeries, they took the eye out, wrapped it, the whole thing, So this is like a really dramatic process and procedure, and I had to heal myself. I didn't get any assistance. I was married to a Christian Scientist. But she was in crisis. She was in Colorado. Her sister had breast cancer. I was back home as a single dad, taking care of my kids. I go into my retina doc. This is a Wills Eye Hospital in Philadelphia. He said, "Your eye is really starting to close. You're in real trouble here." He picked up his cell phone and called two floors up for the glaucoma doc, the surgeon. He said, "We're going to get you set up. He'll see you in 10 minutes." I went upstairs, I reported there, and 10 minutes came by. I said, "Anything going on?" He said, "Well, we'll get to you." Half an hour later, check in. An hour later, check in. 2 hours later. 3 hours later, he sees me. I'm in a panic. I have 2 kids I have to take care of. These are school-age kids. And so his story for me was, sorry about that. We can get you in. I'm not on duty tomorrow. I can line you up with one of my other surgeons. I said, "My wife's out of town. We don't have family here to take care of our kids." And I was just sweating, and I'm making my way home. I called my regular glaucoma doc who sees me. I said, "I need your advice. I need to talk to you." They said, "We'll get a message over to the doc." I said, "This is really urgent," and this is mid-afternoon. He doesn't call back. Then I ring in the morning. The whole day goes by. He doesn't call back, and I just resign myself that I'm going to go blind in my left eye. I was so depressed, and it washes over. It's overwhelming, right? So that story was, the end point of that story was, I went back for my regular appointment 2 months later with my glaucoma doc, who never called me back. The attending nurse sits me down. I tell her my story. She is just stunned, absolutely stunned. And she says, I was into the room, and I'm telling him my story because he says, "So how are you doing?" I said, "Not so great. Now blind in my left eye." And guess what he said, or guess what his response was? He said nothing. He said nothing. He probably saw me as a lawsuit coming at him, right? So the point is that medicine has also got docs scared. They either over-test, over-prescribe, or they run to the hills. They don't even listen to their patients. And it's the assembly line medicine you're talking about, right? So I totally relate to this, and docs are going to be critical to answering this going forward. And then just to touch on Steve's AI thing, it's kind of ironic that my partner and I go back and forth over the role of AI in building out this project. He thinks it's a godsend. I mean, he uses it not just for information, but also asks it for analysis. And that's where I draw the line. It's like, we need to figure this out using the given information. That's what our job is. And some people have just fallen head over heels for AI. They're like all in. They outsource their thinking, their analysis to this entity. So it is a double-edged sword. I'll acknowledge that. It's a good resource for information, but you have to cross-reference. I always said, go to a .edu, go to an academic site to make sure that information is correct. And then I'll stop there. Thank you.
Okay. Scott, thank you. The amazing thing is that when you ask people, if you could just imagine with me, the end of the game, we've got this wonderful utopian society. Everybody gets all the health care they need. Ideally, they get preventive care, so they need less health care, and things like that. In this perfect world, and if I told you we could have that, and it wouldn't cost you anything more than you're already paying, as a matter of fact, it'll cost you not only less, but a lot less, are you in? Now, this group would say, of course, where do I sign? Or if you said to an employer, how much are you paying for healthcare insurance premiums as part of your payroll? They will routinely tell you 20, 25, sometimes 30%. And I say to them, if I could cut that to 10% and all your employees would be covered and you wouldn't have to go to another thought again ever and renegotiate every year and stuff like that, they usually say to me, the employers, the business people, where do I sign? Okay, but on the other side, if I just ask the average person in the street, what would you do if I could offer you that kind of wonderful program? It wouldn't cost you anything, but everybody would get it. You'd be amazed how many people say, I don't like that. And you go, what? Why don't you like that? Well, I don't think people should get things for free.
Yes.
Well, do you get things for free? You go through the usual bleeding heart, progressive kind of analysis. But my point is, all of us are working real hard, and we're going to continue to work because we're crazy. But the fact is that there's an innate something in the American psyche, I think it's unique to America, that frankly doesn't care if the other guy is down as long as I'm up. And they don't care how high the hill is or even how low the hill is, as long as they're on top of the hill. Now, what do you do about that? First of all, you can't wish it away. It's just a fact. That's decades of realizing. You do what Mr. Rogers used to say: find the helpers. This group is all helpers. Find the helpers. There are enough of us, we can make it happen. Thank you.
I'm going to be real quick, and then I want to open it up to questions. When people were talking, a couple of anecdotes that came up, and this is in reference to Steve. I drive down 65, and at the end of the Keys Rocks Bridge, there's always unhoused people, and I always give them a breakfast bar and $1. And I had one woman who I gave her the breakfast bar, and she said, I can't eat it because she had about 3 teeth. And I had forgotten that Michelle only had about 3 teeth. And I had softer bars, but I gave her. So the next day, I went down, and there was a guy down there, and I said to him, do you have teeth? And his answer was, oh, I'm not like one of them. And I thought, holy shit, I guess we do find everybody that's below us.
Mm-hmm.
So the other thing that Chuck mentioned is doctors run scared. It's a CYA medicine. Well, if you've got universal health care, the largest lion's share of cost to malpractice insurance is covering healthcare costs. So pain and suffering, yeah, but there's only so much you can get for pain and suffering. Then it's the ongoing costs of healthcare. If you eradicate that, you've got a huge decrease in those costs. And then Steve was alluding to it. If you go to municipalities, and we did this, we had an analysis done by an economics professor out of Amherst. And we did analysis of municipalities and schools and a lot of different places. They would save a ton of money on a universal single-payer healthcare system because, again, they're not going to pay that redundancy shit that we all pay for. And so I really like what Steve said. You are all helpers. So the more people that we can talk to, and I was talking to the AV person who's Russian, and she says, of course we have universal health care in Russia. And I'm just like, okay. the more people we talk to, then you talk to them. And it's a lot of you are too young, but for those of us who are old, there was a Clairol commercial that was, you talk to one person, I think it was Clairol, and they talk to one person, and they talk, it keeps going, and then you just see the picture get bigger and bigger and bigger. And that's how you reach the masses. And the Russian woman said, at some point, there's going to be a revolution in this country. She said, we went through ours. And I was like, yeah, damn right you did. So I'm going to stop there. So questions that people have, you can use the microphones up there. I think they're live. If you have one, just push the button up.
Oh, there's the mic. Oh, look at that.
Yeah. See the button?
Is that on?
No.
There's the microphone.
See that little button? That's it.
Yeah, I guess it is.
Now it is for sure.
I'm Lou Hansherich. I'm on the steering committee for an organization called Western Pennsylvania Coalition for Single Payer Healthcare. And I want to thank Chuck for bringing up the date he was running for Senate. Because I moderated the debate at Slippery Rock University between Chuck, Bob Casey, and I think Ellen Sanders, an attorney from Philadelphia, and that's 20 years ago, man. And I've been working on this issue at least that time. And over those 20 years, I've spent a lot of time talking to candidates, representatives that are currently in office about this issue. And a lot of the rhetoric I get back is there's not the political will to do it. Well, what is political will? The political will is money. They don't want to give up those campaign contributions to keep them in office or get them elected. Now, things are changing slowly, and I think we're getting closer. We now have a sitting senator, Chris Van Hollen, from Maryland, that is openly supporting Medicare for all. And another issue is like, sometimes there's a lot of confusion about what is Medicare for all. You know, I happen to have made a mistake, and I'm into a Medicare Advantage program, but I was not thoroughly educated about the issue at the time I made the decision. Now, if I want to go back to traditional Medicare, I have to be medically accepted to do that. Whereas when you initially sign up, regardless of your medical condition, you can get traditional Medicare. And in any event, Medicare for all, if we can give it a definition, it would be a comprehensive, publicly financed, nonprofit national health program. That is what we are all after. We don't necessarily want Medicare as it stands right now. We want this comprehensive, publicly financed, nonprofit, public national health plan. And so anyway, I thank you all for being here. This issue we need to resolve this. We need to have Medicare for all, as I've defined it. And I know that there's a lot of candidates out there right now. We have one up in the 16th Congressional District that is supporting Medicare for all. And we should get behind him. And that's Justin Wagner is his name. And there are other candidates throughout the country, a lot of them supported by the DSA, Democrats, there's Socialist Democrats of America, or whatever it is. And, but we need it. And also, I just want to say, I lost the last election, but for the prior 8 years, I was part of the state Democratic committee, and I was working on the inside, trying to get reform. And we've passed, as the Democratic Party of Pennsylvania, we support Medicare for all. But the legislators that represent the Democrats of Pennsylvania, except maybe, if you all remember Jim Furlow, he was a strong supporter, introduced legislation. But that was way back. That was back 2006 or earlier. So anyway, times are getting closer, and we all should get out there and support those candidates that are pushing for it. Thank you.
Thanks, Lou. Lou is right, he's been doing this for a long time. I just want to let you know, Lou, that we had hoped to have Claire Cohen on the panel too. I'm not sure why she wasn't able to make it, but yeah, I mean.
She's a good one too.
Oh yeah, she's excellent, she's excellent, so, okay, other questions?
Scott, could we introduce Gavin, our president of
Oh
the
yeah, I'm so
Healthcare
sorry,
for All
Gavin.
PA?
Gavin is our president of Healthcare for All PA, and he has almost no gray hair.
I see that. He's very young.
Yeah.
Yeah, see the.
I heard he was young.
Yeah. Oh, there it is.
Yeah,
All right. I just want to thank you all for being here tonight, and to thank all of our panelists for being here as well. It is truly inspiring to see all of you come out and support the cause. But what I need you to do when you leave here tonight is go tell a friend. Tell a friend to tell a friend to tell a friend. We need to build an army to be able to get anything done, especially in Harrisburg. We have a bill that will be introduced in September. We need you to rally for it and support it. Write your legislators and tell them to support it. And always, we recommend you donate. None of this would be possible. None of this would be possible without money. And so we absolutely, appreciate all of your support, and we hope that you'll join us in this fight moving forward.
And Gavin, real quick, if people want to take
Oh,
a
yeah.
packet of those, Gavin designed them, because you should have seen my design. It looked like a 4-year-old had done it. So Gavin created those, so please take some with you and pass them out to your friends.
And I would recommend shaking Gavin's hand before you leave.
Just,
I kid him that 20 years from now, this will be governor.
Is it on?
no.
No?
That's what that's.
Thank you.
There it is, okay. I apologize that my question isn't healthcare related specifically, but as I was listening to Chuck kind of talk about how we are in this moment of kind of national emergency, rising fascism, there's a million different problems going on, there's ICE, there's healthcare, there's climate change, everything feels so urgent. So you had talked about, kind of working in the social justice area for your entire life. And just in the Pittsburgh kind of activism scene that we have here, there's no shortage of groups. There's a lot of groups, relatively small typically, and each one of them has their own priority, their own effort that they're working on. And those efforts don't always overlap. So I was wondering if Chuck or anybody else on stage has advice for people who are kind of newer to the activism scene on how the hell to get leftists to work together and pick something and come together in coalition and work towards it. Thank you.
Are you seriously asking?
Yeah, right.
Okay, well, Chuck will answer your question. I'll give you a minute to think. The group that has the most money will be the group that controls. I'm sorry if that breaks anybody's sense of righteousness, but if it's not hard to raise a reasonable amount of money if you know who to go to and how to ask. And I'm happy to be a resource to you if you want to do that. It's once you start getting it, and direct mail is the best way that I have found. These little splinter groups who have absolutely terrific passion, but no resources. If you say, look, we've got the resources, let's get together, we will share. And then you'll find people are coming, not because they're craven, but inside all of us is a little practical person that understands that if you don't have the resources, you're not going anywhere, you're just talking to each other. So that's a suggestion.
Is this one more? Okay.
Yep, that sounds fine.
What is your name?
Molly.
Molly. All right, thanks Molly for the question. Yeah, we've identified about 70,000 identifiable. There are many more, sure, groups that identify as social justice oriented. And 70,000, yeah. And by the end of next week, we're going to be begin onboarding organizations as well as individuals. And I would ask you today, if you could even circulate this, if you want to get on our listserv, this is a forward step, here's a pen. And then this, as I was referencing, I went over it very quickly earlier, talked about the right-wing project that spun out of the Powell memo. It has deeper roots, actually. It goes back to the post-Brown decision, 1954. And at that point, there was a fellow at George Mason University by the name of James Buchanan, a namesake of a president, but he was a 32-year-old economist who came up with a lot of these ideas. And he batted around, and finally he got an audience, but by that point he had alienated himself from everybody. Lewis Powell took over his ideas and then sold them to the Koch brothers. And that's really this trajectory we've been on now for the last 55 years. It's been going on for a long, long time. The answer that we have to do, or we really need to take a page actually from what they've done, is what they create is a common infrastructure. And this is the way the right wing operates, especially Republicans. They go behind closed doors, they hash out their differences, but once they step out of that door, they're together. They are tight, they're disciplined, they're on message. And we don't have that currently. That's what we're striving to do here. I'll pass this around, you can take a look at it. But this is sort of a diagram of what we are, like puzzle pieces scattered about, and then there's the right wing, which is a machine. It operates very effectively. We've got to get to that point. And then we also, these are also places, we call it collective intelligence, where people can come together to share ideas. So it doesn't necessarily have to be around an issue, but learning how to organize, how to build coalitions, how to train new leaders, how to do fundraising, how to teach each other what your success was about, right? Similar to looking backward, which is, how did you do it? What were the ingredients? And so I have a 16-point document that I'm happy to share with people, but it touches on a lot of those different things. One thing to just say about strategy, because a lot of people are really puzzled about what strategy is. The simplest definition I can provide is, strategy is like the recipe, and the tactics are the ingredients. If the tactics don't match the strategy, you're going to have a terrible outcome, right? Or a bun cake or whatever you're making. So the strategy needs to be oriented, again, toward that vision, and then understanding what the necessary steps are to get there. And this project is designed to teach folks how to do this kind of work, to begin thinking strategically. And you can apply it in your own life. You know, you have an ambition, you need to see your success, and then begin to plan on those different steps and go to people with experience, right? And say, how do I become the best dentist? How do I become the best teacher? You need to talk to people with experience, and that's what this is designed to bring people together in a collective. So the idea here is to share information. Training, language really matters. One Payer States is the name of our organization. You know why we call it One Payer States? One Payer is the same thing as single payer, but it opens the conversation. It doesn't
Millions and billions of dollars organizations. So the group's name is Dream.org. And if you join it, it's really easy to join. They give you a free book.
Thank you.
Can I answer your question?
I guess so.
Yeah. I feel like it's my wife, so I have to ask permission.
She knows about your gray hair.
Yeah, that's true.
Yeah, that's true.
She plucks my gray hair.
I think the concept of, like, people call it leadership development in organizing spaces. That's like a very common term that's used. And I think some of that is intentionally teaching people how to think strategically and work across organizations how to think more long term. And sometimes what I see happening in organizing spaces is we are trying to rework the structure. So sometimes all of the thinking just gets thrown out. Like it's like strategy shouldn't be a concept, right? Because it's like nonsense and it's like too quote corporate, like that kind of thing. And the reality is strategy, funding, decision-making authority, governance, these concepts are not like inherently bad. They are important, and you actually have to think about how to do them in the way that is not the corrupt way that you are used to experiencing. And I find that happens a lot in organizing spaces, and I think that's just it's important to realize it's not don't be strategic, it's don't be strategic the way the fascists are being strategic. The two things are really, really different. And I think for anyone who's leading an organization, making sure that your people have the opportunity to experience it. One of the things I've realized, even at work, managing a team, a lot of people, their job experience makes them very, very narrow and siloed. Because if you work in a really big company, you are doing some hyper specialized role, and usually you're getting your wrist slapped if you move out of bounds. So even if you do something slightly different, you get your wrist slapped. So there are people who kind of have even successful careers who they are just really, really used to doing this one very specific thing over and over and over and over again, like a robot. So then when they come into a space that is very wide open, and it's our goal is to reform it's so wide open, they don't know how to operate in that much more dynamic environment, and it's reinforced by pretty much every large company. So I think there is something about teaching people how to operate in this more dynamic environment, which honestly, if you start a retail store, you probably have a lot of experience because it's more dynamic, but it's just most people work for really giant conglomerates because that's the society we live in.
Tweet.
You can hear me without this, but anyway, Tweet Bowie, I'm a physician here. UPMC is my employer. University of Pittsburgh is my employer. I have a hard time talking to my patients about single payer, one payer, publicly funded, because there's so much distress. If you talk about government, they're no, we're not that. Just give you a funny little story. I work at the Birmingham Free Clinic, so I would have these patients, and I'm you should qualify for Medicare, Medicaid. Why are you applying? And he said, well, I don't want government involved in my health care. This is that time when we had all that commercial. So I said, do you know that I'm here because of Medicare? Because I train residents, and Medicare cover, pay for residency training. And he looked at me really? And he walked out. They didn't want government to be involved in healthcare. I'm just telling you one small example. But as a whole, I don't know how best to message that because you can spend a lot of time trying to these myths that people have and try to explain, and it's just hard. I've been trying to do this for a long time, and actually I told my medical students in the same hall recently, I said, I don't think I will live to see Medicare for all or single payer or one payer, I give up. Literally. So actually today was helpful because I think you guys gave me some hope that we can move forward, but I feel like we are a little bit in an echo chamber here.
Yeah.
So I don't have an answer, but anyway, here. I'll turn it on again. I turn it off because I didn't.
Is it on?
Yeah.
I don't know if this helps. I don't know if maybe I understand what you're saying. Okay. And I would tell a lot of my patients this. I've worked in nursing homes for a long time. And I tell a lot of people this. I guess when I lost my job when my brain cancer came back, and it was the year of the pandemic. But I worked in a skilled nursing home at the time. I worked in therapy. and I had to go in for brain surgery, and I knew that I couldn't continue to work in the nursing home, because it was the pandemic and everything. And I told my boss I'm gonna have to quit, and I worked for a contract company, and they said, well, you're gonna lose your health insurance in 30 days. And I thought, oh, shit, I mean, what am I gonna do? You know, I have no income, I'm a single mom, I'm toast, I bought this house, I have bills, what am I gonna do? So I went to the Medicaid office, and I remember going in that day, and I literally cried, because I said I wasn't raised this way. I was so ashamed that I had to ask for help, because I never asked for help. I've worked my whole life, and here I am, and I had to get Medicaid, you know. And I think a lot of people feel that way. They feel shame, like we weren't raised this way. We're Americans. You pull yourself up by your bootstraps. With the system that we have, this is what it is. And then my daughter was like, Mom, healthcare is a human right. Everybody deserves to have it. You deserve it. You know, everybody deserves it. You've paid into the system. It doesn't matter. And I thought about my patients in the nursing home, and every single one of them, if they were there long enough, had to be on Medicaid. They were all on Medicaid. And basically, if you live long enough, you will end up on government assistance at some point. So, especially if you end up in a nursing home, you will end up on Medicaid. And so I always think of that in a comforting way, like, you know what, I'm on it now, I'm on MAUD, which is Medical Assistance for Workers with Disabilities, because I work, and it supplements my Medicare, because I can't afford it, and I pay 5% of my income, and that's my Medicare supplemental, which was very confusing, trust me. That was a very confusing time, but the lady from Area on Aging, she helped me out with all of that, and because I knew I didn't want Medicare Advantage. Like, I knew Scott and I discussed it, but I knew, you know, that I didn't want privatized, like, you know, because they kept trying to talk me into it. And now when they call me, which they do, when the rollover time comes, you know, they call me and I say, nah, I have brain cancer, and they're like, oh, okay. Because if you're sick enough, Medicare Advantage doesn't want you, because they're not gonna cover anything. And trust me on that, they won't cover it. So anyway, if that helps,
that's
everybody, when you get old enough, you will, the government will be involved if you live long enough. So,
no, thank you for that.
Thank you, Sally. Thank you, Sally.
Testing.
One thing that I try and do is, so there's like the breaking the myth one by one, right? Like each individual, and then that is like worthwhile but feels overwhelming because you're like, God, there's 300 million people, so now like what do I do? So then something that I try and do that is scarier for me, but I think is more impactful, is I try and break the myth with my coworkers. Because these are now other people who work in healthcare who have more influence. And it is actually very interesting how, I don't know if this is your experience, but in my experience, there are a lot of people who work in healthcare who don't talk about healthcare. Right? Like they talk about the work, so like the tactical stuff you're doing, you talk about that. But you're not talking about like the system, which is really interesting because like we should be talking, we know it, right? Like we are in it all the time, we burn thousands and thousands and thousands of hours into it, so we really know it. So sometimes I do that because all of my coworkers will have, not that they all have the exact same political views, but they have the same myth that the people have. They're just citizens the way I'm a citizen resident, like, you know, so that pull yourself up by your bootstraps, or like I have another one which is government is inherently less efficient. Like I wrote like a post on my LinkedIn recently being like, hey, everyone's
there's like the primary care people, and then there's the specialists, and we argue over this a lot. And so I think sometimes I give up. I just like, you know, if they're a surgeon, sorry, this is generalization, stereotyping obviously, but if you're a surgeon, you're more likely to be, you know, on the right, and another, you know, things like that. And it's, but I agree with you, like, if we cannot educate the people I don't want to use the word educate because it sounds like I'm better, but if we can't like really talk to the people we work with and make them kind of understand, then that's like, I feel like I fail already.
Yeah.
Just that alone.
And I wonder if there's a way to relate, like just when you said that, I'm not gonna say the name, but there's someone I know who's a surgeon at Allegheny General, and she's been like just talking about how more and more of her time is prior auth. Like, and she's a surgeon, so I'm pretty prior authing as a surgeon, isn't it? Surgery, so like why, but more and more of her time is prior auth, and she had this moment where she posted something about like wanting more, it wasn't even political, it was like more governance, and people started calling her a socialist in her like LinkedIn DMs and stuff like that, and then we like had like back and forth, so maybe there's like a way to relate through like, okay, if like the political topic is like too dicey, can we relate through like, everyone knows prior auths suck, like we all hate that, and maybe there's a way to build up, but it just reminded me of that when you said that, like trying to like start with the
Yeah, but, there's Walter Sue. This is.
Just turn it on.
Go ahead, Kevin. Oh, do you have a? Oh, I'm sorry.
I was gonna add here that just to finish with your question.
No.
here.
There's a question from.
There's an additional question.
Feel free to.
Yeah, just to answer, somebody who was invited is not here. This is actually in his wheelhouse, Walter Sue.
Right.
The former Philadelphia Health Commissioner. And Walter's main presentation these days is healthcare as a public good. And he draws in the examples of the police and the library and the roads. Like, how did you get here? Oh, you drove. You drove on the street. Who do you think made the street? You know, if there's a fire at your house, you're going to need the government to help you put that fire out. I mean, so. But it is a tick. I mean, Steve touched on it. I think everybody has. You know, as an historian, I talk to my students about where does this narcissism thing come from? Well, it certainly was something that the French philosopher Alexis de Tocqueville talked about in Democracy in America, and he called it rampant individualism. And he talked about this double-edged sword. Americans can be great entrepreneurs and creators, but they can also be incredibly stupid, thinking that they're their own agent, they don't have to contact or build community with anybody. So it is a challenge, but again, there's projects, I invite people to join it. I think this is the way we can model the success. Actually, we can create bigger numbers in the right wing, of course, because we get it. We understand the meaning of community, and also the positive good that can come from the government. Without the government, you know, we didn't prevail in the Second World War. Without the government, we didn't create the New Deal. Without the government, we didn't have the Progressive Era or the Great Society and so forth. So, and it's lifted people out of poverty. It's gotten them some health care. But, you know, there were so many positive things. The sad and tragic thing is that the Democrats leaned into the neoliberalism, anti-government rhetoric, I think of Bill Clinton in particular, and that's created its own set of problems. But that's why we need to be the communicators, as you said. Thank you so much.
He's got one. Go ahead.
My name is Darren.
It's flip it up. On the side there.
No, it's not.
Oh, okay.
Anyway, I wonder what we're gonna. The most amenable people to talking about one payer are people that are already getting screwed by the system, or historically have gotten screwed by private healthcare. Just want to make that point. But also, I wanted to mention to have some caution and some healthy skepticism involving the embrace of artificial intelligence when it comes to things like healthcare. A lot of the things with AI currently are very oversold, and a lot of the things that AI is being claimed to be taking credit for, or are often things that are already innovations that are happening in the healthcare field that are beyond just, it's using the buzzword for AI, but also to get into like, the example you gave for nursing homes where it's like, oh, they have such a high turnover rate, more remedying the turnover rate where it seems like the turnover rate for a nursing home a lot of the time has to do with how bad the hours are for the employees and how bad the pay is, and it feels like in a one-payer system, a lot of those things could be remedied, and also it would most likely become like a more stable field of work, and because there'd be like no profit motive for like a nursing home. That would involve squeezing their employees' like pay and their hours, and being able to have them be properly staffed, and be able to just like, because I know it's like also hospitals have the issue where a lot of the time it's like, oh, there's nurses and different like and orderlies and different staff like that being unionized, and then they bring in like travel nurses and stuff like that who are paid at like 5 times the rate, basically just to like shut out people who are unionizing. Well, like, the irony is like, oh, you're proving the money's there, but you don't want to negotiate with nursing staff like that. It's like this is getting a little fractal, but it's more. It's like the main point I wanted to make with that was with AI, where it's like just it's like Chuck, you have a good grasp on it. It seems where it's like, oh yeah, it's like there's things that it could potentially help with, but it's like, oh yeah, just like just hold some skepticism with it. It's like like I can absolutely go in a very specific direction about like my feelings about AI, but it's mainly that, where it's like, oh, bringing back to the labor angle for just like, oh, there's a very large labor angle because there's so many people that are already working in the field, and a lot of people who like, oh yeah, there's a lot of people that get paid like a lot within the field, but there's so many people that don't as well, and it does feel like having one payer system would really help bring a lot of equity to it in general. But that's just what I wanted.
Thanks, Derek. And I completely agree. It's not a tech problem. It's not a tech problem. Like the idea that it is really like it's really funny sometimes to hear healthcare people talk about tech, because like healthcare tech is like it's like not even good tech. Like it's not like we are all the best computer scientists and engineers and this and that. Like that's just not true at all. I have never gone into a healthcare organization and the technology team is like actually like very like respected, and you're bringing in a lot of talent. Like the idea that these organizations could build high-end AI is just not true. Like it's not true. It's not easy to do. It's very, very hard as a science, and like the skill set is not there. I think like some of the framing of like, can you get more people onto your side if you frame it as being like tech advanced, I think some of that is there, but like fundamentally it's not a technology problem. And like I even tell people on my team, and it's all computer scientists and engineers, I tell them like, just remember we're working on healthcare. So like actually like we'll do stuff that's modern and you'll learn and this and that, but like the thing you're gonna learn is healthcare. You're not gonna, if you need to do cutting edge tech, like you have to go to the tech industry. That's where it is. Like you can work on it.
I want to say, I'm sorry, let me say one thing and then your turn, and then I think we're going to wind it down because I'm sure people would like to go. In 1995, I was involved with a group, and what they wanted to do was pick a computer system, an EHR. And so they had, over at the Parkway Center, they had 6 computer systems that they brought in. And all of there were 10 practices, and all of the doctors brought in each other. And I was the only one who brought in 2 computer specialists. And the computer specialists, they picked the 3 top systems. One had number 1 and the other had 2 as 1. But basically they picked the same 2 as the top. The group then went down to Florida. And I don't know what they did to them in Florida, but they came back and they picked like number 6. So I think they ate a lot of lobster. They were in Florida. So I would have to agree with that. Is when you really want to get tech savvy people, get tax savvy people. Go ahead. Do you have a microphone? Okay.
Yeah, I have a question. I really appreciate the AI commentary because I did want to add a little clarification that AI is not a regulated term and it is a marketing term. So I think just what you said, having all these skepticism. But we've been talking about a lot of broad things, and I know I missed, chunk of what you guys had said. So apologies there. My sense of where there is power locally, besides just saying like where there's money, right? If you get to below the surface of who has the money, who gives the people the money? It is the people doing the work, right? Like in a hospital system, it is the doctors and the nurses and the CNA, the janitorial staff, right, who are making the money for these companies. And what's been really encouraging for me to see is the unionization at McGee Hospital. And I guess my question was just sort of like, if any of you have been involved with, or maybe somebody here is already involved with, the McGee's Union of Nurses and working with them, alongside them. I know that they're pushing at the county level for the Parental Leave Act. And I think that Molly asked, like, how do we get all these different people from all these different groups to work together? I think part of it is sort of like, what is getting the most traction? And then if you can join in on that and then kind of say like, hey, this is another thing that I'm working on, you know, then you get some of that like back and forth. And maybe you're not gonna all go in one line. But that, yeah, I was curious if any of you have been thinking about sort of the power of the nurses unionizing locally.
Well, the California nurses led the way for what was almost passed in California as a single payer bill. I mean, they were the leaders. Okay, and that they had everything going for them and came up short. And we've spent a good chunk of our lives fighting this battle. Now we can, and it finally dawned on me, I was going up to bat, and my bat was only 1.5 feet long. And I couldn't understand why I kept striking out. Okay, well, something's got to change. Now I can either just say, it's not fair, okay, and let the working man kind of sympathetic juices flow, okay? And I could feel good about myself. I could quote Martin Luther King, and of all the injustices, injustice in healthcare is the cruelest. That's not exactly what he said, but pretty close. Of course he's right. Oh, he was right then. I guess what I'm saying, and if it sounds cynical, it comes from experience, all right? If we want to go up to bat with a full bat, we have to understand that the people who are running things need to be feeling like there's something in it for them. Over the past 20 years, really from 1980 to the present, we've had a dramatic shift in wealth in this country. Part of the reason the Social Security system is underfunded is because nobody thought that the wealth would skew so far to the wealthy. They thought everybody would be paying into the system. Well, once you reach the cap of your obligation to Medicare, you don't have to pay in anymore. The actuarial plans from 30 years ago didn't anticipate happening what has in fact happened. And the wealthy, the insatiable wealthy, are just wealthier and wealthier and wealthier. Now, you can say, and be right, it's not fair, and if the people would get together and really have a revolution, it would change. And that was, when I sort of talk about the window opens and closes, it opens briefly. When all the stars get in alignment, the planets get in alignment, and we had that in 2008. And we had it when Medicare was first passed, okay? 1964, we had that window, we had Johnson and supermajorities in both houses. It takes something like that to give you a shot. And if you don't get through that window within that 1 year or 2 year interval, you wait, like we've been waiting a generation for the window to open again. I'm sorry to tell you, the window is not open right now. If anything, it's probably more firmly closed than it's been for a long time. Now, what can we do about that? We quit? We're not quitting. So, nice try. We're not quitting. But when I talk about AI, and it's not me that's Mr. AI. I can barely function with it. My point is, where do you think all the money on Wall Street is going right now? I've watched this, I pay attention to this every day. Hundreds of billions, if not trillions of dollars are going into these damned AI centers, which is the equivalent of pyramid building, in my view. Okay, that's about as functional as those will be in 10 years. It's insane that really smart guys and women are doing this. Of all people, Elon Musk is probably the most brilliant because he wants to put it in space where we won't need water and we won't need to cool these systems. Okay, one way or the other, it's going to happen anyway, but my point is, you can be as right as rain on these moral and ethical points, but that's not where the money's going. So how do you get the money to go in your direction? Well, it's like anything else in life. You've got to find out what they want and give it to them in a way that suits you. And so, to the extent that I've made this transition in my own thinking, from bleeding heart liberal to still bleeding heart, but a little bit, stealth about it, is I think there's a way to attract the people who are really running things and get them to say, geez, nobody ever said that before. Nobody pointed out how good it is for us, the wealthy, to do these things, because without a healthy population, nobody's going to buy our damn products. Hello? Okay. Without some kind of system to take care of the older people, we have this paradox that the longer they live, the bigger the problem becomes. Okay? Surviving is not living. Okay? But that's the way we've been proceeding. So anyway, that was longer than I meant it to be, except that believe me, I'm not Mr. AI or Mr. Robotics because I don't like people. It's the opposite. I do like people, and I think that it can either be a curse or it can be a blessing. There's a way to make it a blessing. If we don't fight for it, it's going to be a curse.
So I'm just going to finish up real quick. As far as the nurses at McGee, I've worked with them a lot, and we actually went to the Department of Public Health board meeting, and we were asking with the nurses for 12 weeks of paid parental leave, and the Board of Health came back and said, we want 18 weeks of paid parental leave. So they actually moved the bar further than we did. So I think a lot of it is finding allies. And the reason, Steve mentioned the California Nurses Association. The problem is UPMC has crushed them coming into Pittsburgh, absolutely crushed them and forbidden them from coming in. And now what UPMC has done is hired incredibly good union-busting lawyers to go after those nurses. So, Gavin, why don't you close it up, okay?
All right. I've got one final question I want to answer from each of the panelists. We've heard a lot of suffering, greed, pain, right? This is a tough topic. We're not sunshine and rainbows, but what I want to hear from each of you is one thing that gives you hope for the future.
The fact that despite it all, we're still at it.
That's right, we are.
Out of crisis comes opportunity, and we are in a very deep existential crisis across the board. And I go forward every day. I'm able to get out of bed every day because I'm looking beyond this crisis period as to when we come together and we flip the script. We have to see that. I've shared this already, but I think that's all great societies understand.
People like you guys, you showed up. We show up for each other. I mean, that's it. It's solidarity, the fact that we can all come together and talk, and there are other people out there like me. Like sometimes I wake up in the morning and I think I'm the only one that feels this way. But then when I go out and about, I find out there are other people out there that feel like I do. And if I can make a difference for somebody else and they don't have to go my God, go through brain cancer 4 times to feel this way, it's a good day.
I would say that the thing for me is that it's the young people that are taking the mantle. One of the things that I always worry about is who is going to take this fight forward, because the fight cannot end. We are the only industrialized country in the world without universal health care, and that is unsustainable.
I think the thing that keeps me going is, and I want my generation and like younger people to know this, you can win. You might not win overall, but you can win like real things. Like I've pushed a lot in healthcare in my career and inside the industry. Sometimes you'll do something and it's not gonna make the company money, it's just helping the employees or it's helping the patients, and you can win like real stuff. So when I look at my career, like healthcare is like worse than when I started. So like overall worse, but there are enough wins, and that is motivating. Like it just is motivating, and I just feel like if my generation and like the younger generations feel enough of that win, you'll realize, oh, you can win. Like it's not just all we're screwed, there's no hope, like we have to somehow like convince Elon Musk to do, like we don't really need to convince Elon Musk to do anything. Like you can win locally, you can win in your life, and you can win probably at a bigger scale than you think you can win. And then the moment people realize that, it is motivating, and you'll just keep going, and that motivates me.
Thank you all for coming, and please do take some of Chuck's literature, and please take a stack of the handouts and pass them around, because it has how you can work on our healthcare bill in Pennsylvania.